Dementia is an umbrella term that encompasses various disorders which are characterized by emotional, behavioral, and cognitive deficits. Some common forms of dementia include Alzheimer's disease, vascular dementia, Parkinson's, and dementia with Lewy bodies. Following the extensive use of medications, researchers began exploring non-traditional therapies such as art therapy. Art therapy comprises simple activities such as painting, drawing graffiti, coloring, and making collages. It encompasses two approaches, structural and non-structural. In the structural form, the therapist chooses the tools and the theme, which is used in more generative cases, whereas in the non-structural form, the patient takes initiative. This form of therapy helps build relationships, creates a sense of control over the environment, fosters empathy, and reduces anxiety. It is considered to be psychosocial, which entails a combination of social factors and personal thought. Art therapy demonstrates an overall improved quality of life, which is subjective but refers to an improved standard of health, comfort, and happiness experienced by an individual. The purpose of art therapy is not to assess the individual's art, but rather to enable self-growth in an environment that is safe and facilitating. Non-pharmaceutical interventions, such as music therapy and physical exercise, have already proven to be very beneficial for dementia. So what makes art therapy so special? Research shows that art therapy has been able to alleviate the symptoms of dementia, specifically attentional and verbal skills. This is due to the requirement of focus and engagement it takes to fully immerse oneself in creating art. Feelings of anger and frustration, emotions typical for those suffering dementia, generally decline after a session of art therapy, since art forms such as painting, drawing, or coloring are used as a place of expression and relief, like a visual place to vent. Introducing a routine involving a goal-oriented activity can really bring a sense of accomplishment to the patients as well, overall increasing positive effect. Jennifer Rusted conducted a group analysis on the effects of art therapy on elderly suffering dementia in 2006 and determined there was a significant positive and long-lasting effect on the participants. These individuals showed increased responsiveness, mental alertness, and physical and social engagement overall. This therapy form also provides a very solid platform for communication between therapists and patients, as the caregiver is better able to understand the needs of the other individual in an alternative way. Now you may ask, how does art therapy actually affect our brain? Well, the brain is an active participant in creating visual images. Some pathways that are used when creating various forms of art include the somatosensory pathway, the motor pathway, and the visual pathway. The somatosensory pathway is related to touch, which allows us to perceive vibration, cooling, and heating. Additionally, the haptic sense within this pathway allows us to understand the shape, weight, and hardness of an object. The motor pathway allows us to perform the movements required to create the art that we are working on, and the visual pathway is essential to determine what is seen and where the item is in space. As you can tell, during this creative moment, multiple regions in the brain are being used for various things, and this isn't even all of it. To further solidify the benefits of art therapy, let's have a look at two key studies. The first study monitored participants with dementia in a weekly art program in which they creatively expressed themselves using visual images created on a paper or fabric. By the end of these weekly art sessions, a significant increase in the individual's well-being and self-esteem was observed. In another Paramount study in 2006, 45 older persons with dementia were randomized to either art therapy sessions or recreational activity. Participants showed session-to-session cumulative increases in measures of mental acuity, sociability, calmness, and physical engagement over 40 weeks of art therapy sessions. The recreational activity groups also found such positive changes, but their improvements were limited to the first 15 weeks of attendance. Therefore, while both art therapy and recreational activity are important tools for older people with dementia, it is implied that art therapy has more durable positive effects across time. The sentiments of these findings are consistent throughout various studies, lending confidence to the idea that art therapy is a valuable tool for individuals with dementia. Ultimately, as people with life experience, we all intuitively know that art therapy holds therapeutic potential. However, our treatment of choice for individuals with dementia must be validated by research, not only in the pursuit of scientific rigor, but for the sake of reassuring clients that this therapy will mitigate the challenges they suffer. While many great strides have been made thus far, the field needs to continue to justify art therapy as an evidence-based modality. This can be accomplished by conducting more extensive, large-scale experimental studies with clinical psychotherapists. Unfortunately, this is proving difficult as long-term care homes can seldom afford art therapy for the residents with dementia. Ultimately, however, art therapy is about promoting one's well-being and dignity, and thus, as a society, we play a part in advocating for art therapy programs in institutions that care for persons with dementia.